The following is an encore presentation of a pre-recorded program. Chats and evaluations were only available during the live presentation. To join one of CJE Senior Life's many live presentations, please visit cje.net/events, call 773-508-1000, or follow us on your favorite social media platform.
Hello and welcome to this special joint program of CJE Counseling Services and the Linkages program. Our topic today is Policy, Advocacy, and You, and I'm Sharon Dornberg-Lee. I'm the Clinical Director of Community Services at CJE Senior Life. And part of my role is to serve as the liaison to our wonderful JUF Government Affairs team that are with us today from the Jewish United Fund of Metropolitan Chicago, of which CJE is an affiliate organization. So I'm pleased to be one of the moderators of today's program, and I want to extend a warm welcome to everybody who is attending today. I'm also joined by my co-moderator, Kate Maley. And Kate is our new Linkages program coordinator. As many of you know, Linkages is a CJE program that helps older adults who have an adult child with a disability. And after a number of years of serving as the Linkages coordinator, Mariana Sanchez is now passing the baton to Kate Maley for that role as Mariana moves on to other roles and responsibilities at CJE. And we want to begin by thanking Mariana for all of her wonderful work on Linkages over the years. Before we get started today, to introduce our speakers, we do have a few housekeeping items and announcements that I wanted to mention. First, we want to make sure that everybody knows that CJE Counseling Services, which is a sponsor of this program, offers counseling via telehealth as well as in person at our Rogers Park and Deerfield offices. And we provide individual, family, and group therapy. And we're really pleased to announce that we're beginning 2 new therapy groups in July next month. One is a cognitive behavioral therapy group for those who are experiencing depression or anxiety. And the other is for those living with chronic pain. And this therapy group will help people to better cope with their pain using cognitive behavioral and pain reprocessing approaches. We're also pleased that we've trained all of our clinicians to provide PEARLS counseling. And PEARLS is a short-term evidence-based approach to treating depression in older adults. And for folks who prefer that approach of something more structured and short term, we also have that option available. So for more information on all of these services, as well as any other CJE services, please contact us at 773-508-1000, and we'll be happy to help you and share more information. I also wanted to mention that if there are any professionals in attendance today, unfortunately, we don't offer CEUs for this program. This is a monthly community education series as part of our effort to highlight aging and mental health issues. And professionals are always welcome, but our primary purpose for these programs is to provide community education. So we don't offer CEUs. Also, please be aware that today's program is being recorded and will be available later on our website. If you provided an email when you registered for this program, you will receive an email with a link to the recording. It can take a little while, even a couple of weeks, for that video to be processed and prepared to be posted on the website, but you'll receive that link right away within a day or two. Also, you'll receive a copy of today's slides or other materials that our speakers may choose to share with you. As well, any handouts or anything that we may show you today will be shared with you via an email. Also, you'll receive, actually not receive, but as this program ends today, a program evaluation will automatically pop up. And we really encourage you to take the time. It'll just take a minute to complete that evaluation with your feedback. Also, since this program is being recorded, there are higher privacy features in place. And that means your participation will be anonymous, and we won't be able to see you, and you won't be able to see the other participants. So we ask that if you have a question or a comment, to please use the Q&A feature on your screen to ask questions of the speakers. We have disabled the chat, so just use the Q&A for that purpose. And we do have live CART transcription of today's program, but you'll need to turn that feature on manually. So on your screen, you can select the CC live transcript icon at the bottom of your screen, and then select either subtitles or full transcript views, and you can then adjust the font size to fit your personal needs. We'll be monitoring the Q&A, so if something comes up that is urgent, I may interrupt the speaker, or Kate might with a question, but otherwise we're going to take all of your questions at the end, and we're leaving plenty of time for questions. So with all of that, finally, that was a lot, onto our program. And Kate Maley, please go ahead and introduce our speakers. And I think I mentioned before you say that we do have a sign language interpreter if we can get them into the meeting. We're having a technical issue and are working on that as well. Okay, Kate.
Yes, thank you, Sharon. And hi, everyone. I'm so happy that you're all able to join us today. So I will go ahead and introduce our panelists. Amy Zimmerman is the Assistant Vice President for State Government Affairs with JUF. In this role, Amy leads state policy advocacy initiatives and builds relationships with elected officials, state agency leaders, and stakeholders to promote health and human services, safety, education, and more. Amy previously served as the longtime director of Children and Families Partnerships at Legal Counsel for Health Justice, where she led medical legal collaborations, legislative initiatives, and the implementation of groundbreaking health and special education policies. Amy also served as former Attorney General Lisa Madigan's Children's Policy Advisor and was an attorney at Legal Aid Chicago and Chicago Lawyers Committee for Civil Rights. She has received numerous awards, including honors from the Illinois Public Health Association, Health and Medicine Policy Research Group, EverThrive Illinois, the Public Interest Law Initiative, and the National Center for Medical Legal Partnerships. She earned her JD from Northwestern University Pritzker School of Law and her BA from the University of Pennsylvania. Next, we have Jared Hoffman. Jared began as JUF's Legislative Associate for State Government Affairs in July 2022. He had previously been an intern in JUF's Government Affairs Department, working on a variety of state policy issues, most recently surrounding implementation and improvements to the Illinois Nonprofit Security Grant Program. While in school, he was also an office intern in a local state senator's office. And last year, he graduated from the George Washington University with a BA in political science. And then finally, we have Jane Charney. Jane is the Assistant Vice President for Local Government Affairs at JUF, where she builds relationships with elected and appointed officials at the local level throughout Metro Chicago. Previously, Jane was the Director of Domestic Affairs at JUF's Jewish Community Relations Council and led engagement with African American and Latinx religious, civic, and business leaders. She also handled policy and advocacy on domestic issues of concern to the Jewish community and its partners. And as a native of Moscow, Russia, Jane has led a variety of efforts engaging Russian-speaking Jewish students and young adults. She earned a master's degree in international relations from the University of Chicago and a BA in journalism and international studies from Indiana University. So as you can tell, we have a wonderful group of experts with us today. And with that, I will hand it back to Sharon to move us through the program.
Thank you, Kate. So we're going to keep things moving right now. And our very first speaker today is going to be Jane Charney. So Jane, I'm going to pass it over to you. And I know our goals today are really for both the seasoned activists in the room and for folks who may have never even contacted a legislator ever before, that everybody should have the tools that they need in order to know how to be an effective advocate for the issues that we all care deeply about, whether it's aging issues, disability issues, or both. And so Jane's going to get us started off today. Jane.
Wonderful. Thank you so much, Sharon, and thanks so much for having us here. It's exciting for us to be able to connect with our constituents and with our affiliate agencies. So I'm going to walk us through a little bit about a general overview of what we do in government affairs. And Sharon, if you could advance the slides, please. Let's move on to slide number 2. And then we will talk about local initiatives. After that, I will pass off the mic to my colleagues, Amy and Jared. So as you all know, government affairs is part of JUF, and we're part of a larger department called public affairs. Our role is building and maintaining relationships with elected and appointed officials at the federal, state, and local levels, as well as advocating for legislation and policies that benefit JUF's affiliate agencies and/or Chicago's Jewish community. And that's the gist of our work, because we are both a representative organization of the Metro Chicago Jewish community and a network of social service agencies. Part of our job also is crisis response. We help legislators and other elected officials understand how to best support the Jewish community if, or likely when, a crisis happens. And we help various government entities respond appropriately, even if sometimes we stay in the background. Our relationships with a multitude of elected and appointed officials, as well as coalition partners, help us create these kinds of conversations and discussions and learning opportunities for our partners that then impact how they're able, with the decision making that they're able to have, and the way that they present legislation and policy. You all might know that JUF's social service agencies serve about 500,000 Chicagoans of all backgrounds, and our social services run the gamut, from the therapeutic day schools for kids with intellectual and developmental disabilities to adult day services, from serving people experiencing homelessness to helping families navigate infertility, from Jewish early childhood education to supporting victims of domestic abuse. And of course, a whole gamut of senior services and services for folks with disabilities and their families. All of these agency services and service providers inform our broad policy agenda. In the past year, among other things, we have advocated for increased reimbursement rates for human service providers, funding for nonprofit security grants. My colleagues, Amy and Jared, will address this in just about a minute. We have worked with our federal partners on a national strategy to combat anti-Semitism. We advocate in support for Israel's right to defend itself and maintain relationships throughout the world. I led the recognition of Jewish American heritage at the municipal level, and we have about 15 different municipalities passing proclamations and resolutions in the month of May, celebrating Jewish American Heritage Month. We have also advocated for better access to hate crimes data and sharing of information across law enforcement. And we have supported the ability of Public Defender's Office to represent immigrants. Obviously, these issues are just a few, and these advocacy campaigns are just a few of the efforts that we maintain throughout the year. On the screen right now, you're seeing just a little bit about some of our local advocacy work, including meetings with the mayor, meetings with aldermanic and other city officials. We took a group of Chicago-based labor union leaders to Israel in December. We work very closely with Cook County and with lots of other municipal leaders. But I'm going to take a step back from the local advocacy work and just, go through a little bit about how we decide what legislation is particularly relevant to our issues, and then I'll go back into the local policy initiatives. So what makes a particular piece of legislation relevant, and how do we decide to take action? JUF has standing policy positions on a myriad issues. We first see whether the issue is part of the extended policy agenda and whether it fits with local, state, or federal goals. Again, these are guided by the work of our agencies and the needs of our greater Jewish community. If the issue is not currently on our policy agenda, we look at whether the outcome of the legislation will impact either the community members in Metro Chicago or the work of our agencies. And then we look at who originated the legislation, which coalitions are supporting, and whether we're already in partnerships with those coalitions, and whether we need to lead on this issue or simply be present and follow the advocacy work of other coalition members. So for these reasons, our advocacy pathways are very different from each other, depending on the issue and from the level of government. So as my bio mentioned, I'm the lead staff person for our local policy agenda, and I work with members of the municipal governments throughout Chicago. So what have been some of the initiatives that are relevant to the folks on this call and to CJE's work in general? One of the key policy priorities is supporting aging in place. So services that seniors and people with disabilities can receive in their home, whether it is home health providers or vaccination at home, or being able to receive educational materials, being able to vote at home. All of these are part of our advocacy agenda. For example, during COVID-19, I served on several municipal task forces, including with Chicago and with Cook County, and helped originate the home-based vaccination program that the city of Chicago ended up providing, simply because that had not been on the radar when the first vaccines were available. But in consultation with my colleagues at CJE and at JCFS, formerly Jewish Child and Family Service, we were able to recognize that so many folks are not able to make it to some of the city vaccination sites, whether it's the United Center or it's the Horwich JCC in Rogers Park. So paramedics and fire department volunteers were able to bring portable vaccination clinics to some of the locations where folks were homebound. Over the last couple of years, I have also been part of a broad Illinois-based coalition of service providers and advocates, particularly legal aid advocates, who are working with the Social Security Administration. As you all know, the pandemic wreaked havoc on the way that the Social Security Administration is able to consider cases, able to issue disability determinations, able to answer phones even. And so we are part of a large coalition that is working directly with the regional offices, with the various regional managers, and with the regional commissioner to ensure that not only are Social Security Administration employees available, but also that they're trained correctly. For example, one issue that we were running into again and again, and this is thanks to my CJE colleagues who notified me, is payments from the claims conference in Germany were being labeled as income when they should not have been included in the maximum that SSI recipients are allowed to have. And that is a training issue that, at first, when we started working with the Social Security Administration, the answer was, well, we're so understaffed, we keep hiring new people, they just don't know. Well, let's create some processes around training. Let's figure out a way that everybody in the regional office is aware of the needs of the clients. Of course, that feeds right into the workforce shortage. Across industries, we have seen closures of agencies, closures of a variety of businesses because there are not enough folks being employed, despite the fact that we have a really low unemployment rate right now. So we are working to support partnerships between the Chicago Department of Family and Support Services and the city colleges to train more professionals who are able to assist seniors and people with disabilities, in particular, again, related to the aging in place work. So home health aides, nursing staff, visiting nurses, et cetera. That is in process. There was a budget commitment from the previous mayor to support this effort, and we're hopeful that the budget commitment will be maintained. And then, of course, another huge issue is payment rates and the idea that our staff in these very necessary professions are not making a livable wage. And so supporting increases for senior and other care providers. I'm going to stop here. Actually, sorry, no, I'm not going to stop here. Just very quickly, what are we doing on the local level beyond policy advocacy specifically? As I said, I serve in a variety of city and county committees representing JUF and our agencies. I work to build coalitions or participate in existing coalitions throughout Metro Chicago, including with other social service providers. And of course, a huge part of my job is maintaining relationships with elected and appointed officials at the municipal level. And you all know that Chicago isn't just the city of Chicago. It's also Cook and Lake County. It's also a little bit of DuPage County. It's various municipalities and townships that each have their own processes, each have their own bodies that control funding streams. And of course, we then, when we do find legislation or policy proposals, resolutions that are beneficial or not to our agencies and to our community, just as my colleagues on the state and federal level do, we, of course, file testimony and create direct advocacy work as well. And now I am going to stop and I'm going to pass the presentation off to my colleague, Amy Zimmerman. Thank you so much.
And you can go to the next slide too. Thank you. Good morning, everyone. I'm Amy Zimmerman. I'm delighted to be with you this morning. Just wanted to start off with a few pictures about our featuring some of our advocacy in action. If looking at it, beginning on the left-hand side, we have JUF's Rabbi Greenie Dickman, and we were with her at a successful assault weapons ban rally in Springfield when the assault weapons ban legislation passed during the lame duck session last January, this past January. We also, you can see we've got Representative Jennifer Gershwitz. You feel the raw emotion in the air. I believe that was after Jennifer's legislation for the teaching of Asian American history passed in the General Assembly. Here we are with members, Representative Kevin Olacall and Senator Ron Villavalem at CJE, getting a tour. It's really great when we can bring legislators out to the agencies that we work with, have them really get a sense of what our affiliated partners do to serve the community, where they have challenges, where they have model programs that could be replicated across the state, and thinking of those opportunities to be able to collaborate with the Illinois General Assembly. And then the last picture there is a picture we took on one of our Intellectual and Developmental Disability Advocacy Day with participants from JCFS Chicago, Keshet, Labenu, and we're in the rotunda with Senator Feigenholz. So whether it's in district or in Springfield, there are myriad opportunities to engage in advocacy. So let's go to the next slide. I'm going to take you through our patented, joking, advocacy formula. Really what this is sort of in a perfect world, what getting from idea to passage of legislation can look like. And here's sort of something that we try to follow. First, identifying the issue. JUF and our other partner agencies have both on the ground experience to identify issues and the expertise to identify solutions. But issues can also be identified through task force and coalition work, which our government affairs teams are members of at all levels and of government. And CJE staff also serves on various coalitions, which is exciting and gives us opportunities to collaborate. Additionally, constituents can bring issues directly to state senators or the representatives and work with them on legislation. And I'll tell you all a quick story about that if I have an opportunity to. We like to, whatever issue we're working on, it's very helpful to create a white paper, an issue brief. It's a great way to identify a problem, the problem's impact and potential solutions in a real fact-based approach, which is difficult for opponents to refute. It's important to identify potential solutions and examples from other states. The General Assembly, for better or worse, likes to see that they aren't the first to adopt a legislative fix. We've had especially great experiences working with Jewish caucus members as sponsors on our legislation. So it's important to get a chief sponsor and then gain other sponsors. It's especially helpful that most of our Jewish caucus members are in districts where our partner agencies are situated and serving constituents in their district. It's also really important to develop a fact sheet. Fact sheets lay out the issue in a really brief, concise manner and also describe the solution. What is the legislative fix that's being proposed? Why is it important? It's also a place to list all of the chief sponsors, the co-sponsors, and organizational supporters. Those are really things that are important to members to see, especially a number of organizational supporters. And Jared will take you through sort of how they end up seeing who is supporting when he takes you through filing witness slips. JUF missions have been a wonderful opportunity as a way to gain legislative sponsors. And we often use our involvement in various coalitions to gain other organizational and advocacy supporters. Moving on to testifying, we testify at committee hearings. We recruit agency staff to testify as experts at hearings. And we prep our legislative champions to be able to answer questions during hearings. So when a member is at a committee hearing, or they are working to get votes on the floor, they need to understand and be able to also advocate for their legislation. Also, negotiating with stakeholders is critical. Sometimes we have stakeholders, and we have an example from a bill that we worked on this past session. That was the Human Services Loan Repayment Program. That legislation passed in spring of 2022, and the act currently covers loan repayment assistance for community-based human services organizations. When I saw the legislation, I knew that with just a very small tweak, we could modify it so that it could be extended to also apply to individuals that work at community-based childcare centers. And so I worked with the organizations that were the proponents of that bill. And this session, because they had to do some other small legislative fixes in the legislation, worked with them to add the language and able to successfully get that legislation passed. The program itself also got an appropriation this year, but not as much as they would like to see. So getting to neutral. Some people might find it surprising that the General Assembly doesn't always value state agency concerns, but it's important where you have legislation that impacts a state agency, and most of it does, because they might be implementing it, monitoring it in some way, or it might change state agency practice. But it's important to try to get them at least to neutral, where we can't get them to actually support it. We also try to avoid having a fiscal note on the bill, because that can sometimes stop bills in their tracks. So, for example, our bill, which we're going to take you through, HB 1187, which is improvements to the nonprofit security grant, that we negotiated with IEMA. They were initially opposed to it. And we worked out agreed language for the bill. They didn't end up slipping in support, but they were neutral. And that was very important to being able to actively move that bill forward, which ultimately passed. And I'm going to take you through that. Quickly, just to tell you, one thing I can say, you can keep that slide up, the priorities, that's fine. You can go to the priorities slide. But one thing I can say, when you as a constituent bring legislation to a member, it's absolutely appropriate to do. They will work with you. They can directly bring the legislation to the folks that write the legislation in Springfield. I think where it can get difficult, and that's why it's nice you can bring things to CJE or to us. It's helpful to have advocates that are on the ground, who are going to Springfield, who can actively testify in support of legislation. We discovered a bill, I think it was not this past session, the session before, HB 40, which actually was an initiative from a constituent working with the legislator to file a bill that allowed individuals with IEPs, individualized education plans, to stay in their school placement until the end of the year following their turning 22. So if they turn 22 in October, ordinarily that would be the end of it. They wouldn't be able to stay the rest of the school year, graduate with their peers. And this legislation changed that. The problem was there wasn't really anyone working it. It was a wonderful piece of constituent legislation. So we saw that bill, we really adopted it. We wrote the fact sheet for it. We worked to negotiate where necessary, and that bill ultimately passed. So there's really benefits, but I would say when you're introducing or working with a legislator to introduce a bill, it's really helpful to get support from coalitions or other organizations that could really help work it. Let's go. Okay, so we're on the spring priorities slide. Yay. We had a number of priorities this session, but because our time is limited, Jared and I are going to take you through only a few examples of our advocacy and action from last spring that impact security, supports for individuals with intellectual and developmental disability, and senior services. Let's go to the next slide. So JUF's #1 priority this session was funding for and improvements to the Illinois Nonprofit Security Grant Program. This is a program that was passed into law in 2017 as a state supplement to the chronically oversubscribed federal NSGP program. Under the program, vulnerable nonprofits and houses of worship can receive funding to enhance their security through physical security upgrades like bulletproof glass, cameras, access control systems. They can also use the funding for security and preparedness trainings and for contracting with security personnel. But despite having passed on a broad bipartisan basis, this program went years without ever receiving a funding appropriation. So recognizing that the program is an important tool to keep Illinois' most vulnerable communities safe, I was able to spearhead the creation of the Safeguard Illinois Communities Coalition in 2021. And the coalition is a diverse group that has grown to 60 nonprofit, cultural, civic, religious, and ethnic organizations across the state that are committed to two interrelated goals. One, the inclusion of funding for the program in Illinois' state budget each year. And two, program implementation that is navigable, accessible, and equitably distributed to eligible entities. So after significant outreach and engagement with the governor's office, our legislative caucuses, including the Black, Jewish, Asian American, and Latino caucuses, in July 2022, the program received its first appropriation, with the General Assembly approving $20 million to fund the program. We worked with IEMA and help them develop the application. And the first application was open between November 2022 and January 2023, and 116 organizations received an award, including a number of our coalition members. While JUF and the coalition are thrilled that the program was funded, received an appropriation, what we realized through working through the application process was that the statute, which initially created the program in 2017, it placed several limitations on the ability to maximize the program's reach and participation for vulnerable nonprofits and houses of worship. So accordingly, we drafted HB 1187. It was introduced in January after negotiating amendments with IEMA, the Illinois Emergency Management Agency, and it subsequently passed. Oh, let's go to the next slide. I think no, keep it on that slide. I'm sorry. Go. You can go back. I'm sorry. The bill was amended. It passed the Illinois House and the Senate unanimously. It is waiting for the governor's signature as we are having this session right now. It accomplishes 5 main objectives that you can see. It updates and clarifies the language to better reflect the threat environment facing nonprofits, which is really domestic terrorism. It ensures eligible upgrades under the state program are consistent with the federal program. The federal program offers many upgrade options, and we wanted to make sure that the state offered the same upgrades. You can do self-assessments. The federal program lets you do self-assessments, and sometimes it's hard to find someone to do a security assessment of your building. Although they are available for free, it can often be sort of backlogged, and JUF does provide those assessments too. But sometimes it's appropriate to be able to do your own assessment, and the federal government allows you to do that. We wanted to make sure people had enough time to fill their application out. So it requires a 45-day application period. And it requires IEMA to do a lot of different outreach. And that outreach is specifically delineated in the bill. So let's go on to the next slide. This is our coalition. It is a robust, diverse membership of cultural, civic, religious, and ethnic organizations, and we continue to grow. One thing that I didn't mention is that we did get $20 million again for this year. This is fiscal year 2024, goes into effect July 1. And we were also able to get a sort of a permanent line item in the budget. So we'll work to have it funded every year, but it makes that process a little less daunting when you have a line item in the budget. You can go to the next slide. The next bill that I want to talk to you about is our advocacy around what's called occupancy factor. HB 3344 aims to begin to address the financial hit our intellectual and developmental disability providers experience as a result of a policy through the Department of Developmental Disabilities, and it's called the Occupancy Factor Policy. Under this policy, which began in January 2022, if a resident is absent from their residential placement, their CILA, beyond 18.5 days a year, regardless of the reason, the provider is not paid for these absences. The bill begins to address the issue by providing that when residents of a CILA have a medically required absence, the department will reimburse 50% of the state daily rate after the 18.5 occupancy factor days have been surpassed. So it's only 50% because the other 50% is Medicaid covered, and Medicaid will not allow billing for the medical placement plus the CILA. So it's a 50% reimbursement. Absences covered under the bill include, but aren't limited to, hospitalization, placement in short-term stabilization homes or state-operated facilities, rehabilitation facilities, long-term care facilities, nursing facilities. The bill also provides that a resident may return to the CILA after they are medically able to do so. And while the bill did not move beyond committee consideration, The department is committed to addressing this issue in a Medicaid waiver application this summer. And we'll be monitoring the application to ensure that it addresses not only medical absences, but also other absences. For example, like Jewish holidays, Shabbat, family vacations, and other planned absences. We have a number of residents that spend a month each summer in supported summer employment at Jewish camps and overnight camps. So we led this advocacy with our Encompass residential partner agencies serving individuals with intellectual and developmental disabilities, including JCFS Chicago, Lebaino, and Keshet. I'm featured in the picture with Representative Ness, Suzanne Ness, who is the bill's chief sponsor. And this is from a House Committee subject matter hearing where I was able to testify along with JUF Encompass Director Jody Newmark and Shana Ehrenberg, President and CEO of Lebaino. And I'm gonna turn things over to Jared.
Yes. Thank you, Amy. Good morning, everyone. Now I'm going to talk about the piece of legislation this session that we primarily focused on in the aging, covering aging issues. So JUF is an organizational member of the Illinois Aging Together Coalition, whose main legislative priority is the passage of the Aging Equity Act, this session having the numbers House Bill 1237 or Senate Bill 2032. Now, this very comprehensive legislation would establish the Aging Equity Planning Commission to be led by representatives from the Office of the Governor and the Illinois Department on Aging. And the idea is that this commission would craft a 10-year strategic plan with concrete policy recommendations addressing a multitude of issues surrounding aging. Some of them you can see on the bottom left here, and that's not even all the ones covered in the statute. And it even goes beyond that to looking at revenue streams that would go to fund such services. So the scope of the commission, as you can see, is extremely vast and very encompassing. And in addition, the makeup of the commission itself would be very encompassing of the different stakeholders that are involved. Membership on the 5 committees that are required as part of the full commission would be required to reflect and include the geographic diversity of the state of Illinois, consisting of members who are 60 and older from urban, suburban, and rural areas, in addition to specified professionals with expertise in various aspects of aging, such as home and community-based services, and state agency participation is also a major factor on this commission because it's really looking at, as you can see in the chart on the bottom left, Illinois' population is aging, and it requires whole of government approach for everyone to be on the same page and really look at so many of the facets that impact aging. And so a lot of questions people ask about this legislation. How is this different than what the state and the Department of Aging do now? And currently, the Department of Aging only reviews their state plan for aging every 3 years as required by the Administration for Community Living, part of the U.S. Department of Health and Human Services. So this is obviously much wider in scope, and it looks at the issue over a much longer period of time. And according to the Illinois Aging Together Coalition, the states that have enacted plans similar to this that look at aging at a more multifaceted way and over a longer period of time have better outcomes. So currently on metrics such as choice of setting and provider and quality of life and care, Illinois ranks pretty low in the 40 to 45 range of the 50 states plus DC. So there's a lot to be done in so many of these issue areas, and by establishing a commission looking at these issues more long-term, hopefully Illinois can improve its services. And I want to talk specifically about JUF's role in this legislation. As the language was being crafted, we wanted to ensure that the commission would also look at the individuals with disabilities as they age to make sure that those individuals would also be considered and examined by the commission subcommittees. And in terms of status of this legislation, it's been introduced in the General Assembly for the previous couple legislative sessions, but it is yet to gain traction beyond committee. So there'll be a much increased push this coming spring, hopefully, and it'll move forward in the last session here of the 103rd General Assembly. We can go to the next slide. So that's a specific bill. So I think it would also be helpful to share what were the big other aging-related legislative priorities that passed this session and what was in the state budget. So the biggest aging-related line item in the state budget this year was a $24 million rate increase for home workers who assist the elderly, with pieces of this 24 million going towards increased outreach and an additional 2.3 million for adult day services. Another important line item in the budget was an $8.3 million increase for the home delivered meals program. And on some specific legislation that has been highlighted by aging advocates, one bill that was very important was House Bill 3957, and this is a bill that aims to crack down on generic drug price gouging, which is obviously an extremely important issue for many seniors. And so the bill defines gouging as an increase in the price of a medication, 30% within 1 year, 50% within 3 years, or 75% within 5 years. And so what the bill does is it creates a pathway for the Illinois Department of Healthcare and Family Services to notify the Attorney General of Illinois of any suspected price gouging, and they can subsequently bring lawsuits against violators. And another medication-related bill that passed this session, House Bill 2189, the Access to Affordable Insulin Act, it caps co-payments for a month's supply of insulin on state-regulated health plans at $35 per month, down from the current amount of $100 per month. So this will help ensure that individuals with diabetes, especially those with lower fixed incomes, do not have to choose between medically necessary, life-saving medication and their financial well-being. And lastly, I'll touch briefly, Amy mentioned a couple of these workforce initiatives that went through the General Assembly this session. First, huge initiative highlighted by advocates was a wage increase for direct support professionals who serve individuals with developmental disabilities. The advocates had been pushing hard for a $4 an hour wage increase because we know how horrendously underpaid this workforce is. And in the end, though the governor proposed $1.50, we were able to secure a $2.50 per hour wage increase, which hopefully will help with workforce retention and recruitment. And in another bill, Amy highlighted House Bill 2380, which JUF authored an amendment to the Human Service Professional Loan Repayment Program, which, as the name sounds, it's a student loan forgiveness program for individuals working at community-based health service providers. And lastly, I'll mention Senate Bill 57, since behavioral mental health is such a huge issue we're all talking about now. It will raise the maximum loan forgiveness level for people who work in behavioral health fields, such as psychiatrists, nurses, physicians, social workers, et cetera. And this loan repayment program is scheduled to go into effect next year. So we'll go to the next slide. I'll be very brief on our federal policy priorities. So these are the main issues that JUF is working on and that affect seniors at the federal level. I'll talk about a successful initiative first. The Able Age Adjustment Act was passed as part of the comprehensive federal budget package in 2022, not a standalone bill. And for those of you, I'm sure many of you are familiar, ABLE programs are state-run programs where individuals with disabilities can save for long-term care and disability expenses without risking the loss of any federal benefits. And prior to the passage of this bill, you needed to have obtained your disability before the age of 26. This legislation raises it to 46 to incentivize more people to save and vastly expand the amount of people who can save. Second, this is a important issue that's also pending now. This bill, the SSI Savings Penalty Elimination Act, has not been reintroduced this session, but what it would do, it would, under current law, recipients of supplemental security income cannot have assets greater than $2,000. And this has not been changed in decades. So advocates are pushing to make it $10,000 for individuals, $20,000 for couples, because it completely disincentivizes people's ability to save money. And I won't go into many specifics here, but like here on the state level, there's a lot of workforce related issues that are being discussed at the federal level. I'll specifically highlight the visa recapture one because that's being led by Illinois legislators, specifically Senator Durbin and Representative Schneider. And the idea would be to free up more visa slots and prioritize people who are skilled workers in health and human services. And lastly, FMAP increases. So during the pandemic, FMAP is the percentage rate that the federal government pays to states for Medicaid matching. And during the pandemic, there was a 6.2% across the board increase in FMAP. And it was hugely impactful for state budgets and access to Medicaid. So advocates are pushing to see it increased again, probably not to 6% again, but at least any increase would be helpful. So we can go to our next slide here. So now we've covered some of the specific priorities and policies that JUF has been involved or supported this last session. But now let's talk about the ways that you can be an individual advocate and be more involved. And I'll go through some specific examples of these as we go on. So identifying coalitions and organizations, I'll name a couple at the end here, but find organizations and coalitions that do advocacy work in this space or any space that you're passionate about. Sign up, get their email updates, go to the events that they put on. And like I said at the end, I'll have a couple for you that deal with aging related issues. And serving on statewide task forces, if you are someone who has a specific expertise or passion on a specific aging related issue, when we send out these slides, you can see if there's a state task force or commission that you can apply to serve on. If you really have a passion or expertise on a certain issue, you can apply to serve on these task forces. And there's hundreds of them across the state. Amy spoke a bit about legislative office visits and lobby days, something we do extensively. And I've come to find that state officials are usually pretty accessible. So if you have a personal story, you have a specific expertise or an initiative you want to talk about, try contacting your legislator. They love to hear from their constituents who have personal stories or expertise on an issue. Witness slips, which I will take you through how to do in a minute. It's a very quick and easy way to voice your opinion on a pending piece of legislation. And it's also an important tool to demonstrate that there's community interest in a specific bill. Media engagement, letters to editor, always important. You can write an op-ed or a short editorial for your newspaper, elevate an issue. You can write to your elected officials as well that a certain issue is important to you. And lastly, again, something JUF does extensively, commenting on proposed rulemaking. After legislation passes, there's always a public commenting period. And it's a great advocacy tool for you to help shape a program before it actually gets implemented to ensure that your concerns are met. Next slide. Okay, as I mentioned, I was going to tell you about some aging related issue coalitions that you should check out when we send out these slides. The Illinois Aging Together, I spoke a bit about this organization. They're the ones leading the bill I spoke about, the Strategic Plan for Aging Equity legislation. As you recall, the issues that they cover are vast and all-encompassing of all issues surrounding aging. And on their website, you can see when they have their information sessions and perhaps attend one and see if you want to get more involved with them. And another one is the Illinois Family Caregiver Coalition. It's a newer coalition. I don't have as much experience with them, but as you can tell by the name, they are more single issue focused on supporting family caregivers and assessing public policy options to support those who are caring for their family members and often don't receive any compensation or any type of support when they're doing very difficult work for their loved ones. And we'll go to the next slide. And cognizant of time here, I'm going to quickly go through how to file a witness slip, which I said is one of the most accessible and easy ways for you to have your voice heard on a specific piece of legislation. And I'm going to remind everyone, we'll send out these slides. I don't expect you to remember where to type everything in and where to find everything on the screen here. But I'll take you through using the example of House Bill 2380, which Amy spoke about, the bill that expands access to the Human Service Professional Loan Repayment Program. So you go to ilga.gov, which is the Illinois General Assembly's website. And if you follow along in the red boxes here as we click through these, you search for the bill number. Yeah. And then the next slide takes you to the bill page. So it's important procedurally to know you can only file witness slips for bills if they're actively scheduled for a hearing. So on the bill page, you would see here in the red box that's at the bottom, there's a hearing schedule that was on March 8th, 2023. So that means you can file a witness slip for legislation. So then you'd click on witness slips, which would take you to the screen on your right, and you would click the blue hearing notice for higher education. And you can also see if other individuals and other advocacy groups are engaged in a certain piece of legislation. So the next slide would be after you click on the hearing notice for education, takes you to the committee page. I know there's a lot of clicks. So then again, it shows you all the bills listed for the hearing. You would click create witness slips, and then on the right side, you would find the bill that you're concerned about and click the little pencil icon, which will finally take you to the screen to actually fill out the witness slip. And we'll go to what the witness slip actually looks like. So all the fields on the witness slip itself are pretty self-explanatory, except I always caution when we talk about the firm, business, or agency. For this audience, you're always going to want to put self when here, because you're not necessarily representing an organization. Only specific staff at organizations are supposed to fill out witness slips on their behalf. So it's always the safer bet to put self. And then if we go to the second one, again, on the representation, you're representing yourself. And then you actually indicate your position on the bill. And I've seen many times, make sure you click the right position. Proponent and opponent are similar words, and I've seen many people click the wrong one by accident. So it's always important to double check that. And the last one, testimony, most oftentimes you're just going to be filing your position. You're not necessarily going to testify at a hearing or submit a written statement. It's just to show that this is your position on the bill. And so I know there's a lot of steps and clicks involved in filing witness slips, but it is truly one of the quickest and easiest ways to register your opinion on a piece of legislation. And it really elevates that community members are engaged and are caring about this bill and that it impacts these lawmakers' constituents. Yeah, so I think that's all I have on the witness slips, and thank you.
Wonderful. That was a lot of terrific information. The three of you covered so much, and it was a lot to absorb. But remember that this program has been recorded and you'll be getting the slides. And I am seeing some questions come in the Q&A, and it's not too late to add questions there if questions are coming to mind. I was just going to add to what you said about the witness slips, Jared, that I think very often as an advocate, you just get a link directly to that slip. So don't be intimidated by all of the clicks that Jared went through where you're seeking out a piece of legislation. Often you might just receive a link directly to that last page and need to know how to fill it out to file whether you are a proponent or opponent of a piece of legislation. Kate, do you want to go ahead and read the questions in the Q&A?
Yes, I will. So the first question is more about a specific piece of legislation that you all talked about today. So the question is, certainly care providers deserve a livable wage, but rates paid for in-home care providers have skyrocketed in the last few years. So how do you give consideration to balancing a living wage for care providers with the ability of seniors to pay for these services?
Well, I can start off. I think that, I mean, you've definitely highlighted a real challenge for providers, for the state. I can tell you in terms of our advocacy, we really focus on the contributions made by the state agencies. So having Medicaid rates increase, which you should see. So for any providers that are billing Medicaid, the state is increasing those rates as high as 10%. So there is that, ability for those individuals to be paid more that way. I think that, there was just a real tension during COVID, and it continues. There was a crisis in staffing, really in every caregiving arena. And as far as the state's concerned, I really do think they are working to address it. It isn't perfect, at least, for example, for direct service professionals that work with individuals with intellectual and developmental disabilities. We were able to get a $2.50 raise increase. So they will be paid, at least in the Chicago area, they will be paid over $20 an hour. But this is something that we're going to be continuing to grapple with.
If it's okay if I weigh in too, Amy, thank you for those comments. It is important to understand too that these wage increases are for people who are being paid by the state, not by consumers.
Right.
So in order for the state, for example, through whether it's through DOOR services, the Department of Rehab Services, and people are having a personal attendant, or whether it's through the Illinois Department on Aging, the community care program for our homemaker services. Those wages have been much lower than in the private sector if somebody was hiring a caregiver privately through an agency. And so there's been a huge shortage of workers through these state-funded systems that is really creating a great difficulty in finding workers to provide these services because they can make more in the private sector. So this really does a service to people who may have subsidized care so that wages can at least begin to compete with what the same worker might make elsewhere. So it really adds to that pool of state subsidized workers, which is badly needed. We were just talking about this morning. There's really a crisis in terms of the cost of hiring a personal care worker in the private sector because people are charging sometimes $40 an hour through agencies. And it's just become really unaffordable to the average person who needs it, despite the fact that these folks work incredibly hard and need to make a living wage. So there's a tension there. And I think this will help to have adequate workforce for people who receive services through state-funded programs.
And one thing I want to add is, part of this dichotomy of really high rates in the private sector and low income for seniors in general is a reason that JUF supports federal improvements in Social Security Administration's programming and the removal of the income cap, because currently it's you are allowed to receive $2,000 per month and to have it on hand, right, as outside income. $2,000 doesn't really cover much, right? So if you are a senior who has worked their entire life, for example, or if you're receiving disability payments, you are mandated to have only a very small amount of money in your name. And in order to be eligible for continued Social Security Administration payments, and then those payments, the cycle keeps repeating itself, where if you've crossed that cap, and then you're no longer eligible for the SSI payments or for support in terms of trying to pay your home health aid or other folks who are coming to your home for supportive services.
Thank you, everyone, for weighing in. It's a really important question and appreciate all of that thorough detail. I think we have a couple more questions more on advocacy process. So the first one is it better to personalize a letter to an official or a representative? Like, does using a boilerplate template make it less effective?
Yeah, my response would be, I think it's a little bit of both. I think that what I've actually noticed with some of these boilerplate templates that go out, you can modify the language that they've provided you with. So where you can speak about something from personally, it's always going to resonate louder and further with elected officials. And so but it's also meaningful to get thousands of emails sent to you, right? So I think you have to sort of figure out what do you have time to do. So there's nothing wrong with sending those, the sort of alert and responding, but where you have something personal to say, then I would work to try to modify that template. And, and so with regard to really reading, digesting, and following the submissions, I do think where they are personalized and you put that up front, you're more likely to have a legislator read it, but there is an impact of receiving thousands of emails or thousands of calls.
And I would also add that for our federal colleagues, Whenever we comment on federal legislation or submit comments on behalf of the community and invite the community to do so, they count individual comments that must be unique. So if you end up submitting, the same comment over and over again, those comments are counted as one. And sometimes what you want is to actually see, the number of comments on a particular piece of legislation or proposed rules, et cetera. And so they must be at least somewhat different from each other and include some kind of a personalized message. And that is a feature, I believe, unique to federal legislation.
Yeah, that's specific to federal rulemaking. So when they go through the rulemaking process, that's a specific feature of federal rulemaking. That doesn't happen at the state level. So if you submit comments on rulemaking in Illinois, you actually could copy someone's, and that would be allowable.
Helpful. And kind of an extension of that question, with all of these automated templates, do those legislators really read, digest? Do they follow these submissions?
Right. I think that's what we were saying. If it's personalized, they're going to look at it more closely, but it does have an impact when they do get a number of them. They realize that this is something that is the community is wants their voice heard on.
Well, how would you recommend keeping up to date on all of this legislation? This person says it's really important, but I sometimes find it hard to follow all the many steps along the way.
I would say at the state level, it is really helpful when you identify the issues that you're interested in. You will find that the coalitions will send you emails. They will tell you the legislation that they are working on, who is sponsoring it, what has happened with it. And so they really try to make it approachable. I can tell you at JUF, Jared and I do this full time and we can't follow it all. There were over 500 bills that passed this past session. Thousands were introduced. We have a bill tracking service that lets us know when an amendment has been filed on something, when it's been assigned for committee, when it's up for hearing. So, this is a full-time job for two people, for us, covering a host of services that and agencies and programs. But I do think that when you find coalitions that are focused on your target area, that they will absolutely let you know. And for you to know as well, when you go to the General Assembly website, they actually do broadcast everything. When they're on the floor in the House or in the Senate, you actually can watch it, which is really great. When they are in committee hearings, depending on the capacity of the room, you can either watch the hearing or you have to listen to it. But if you know that a bill is coming up, and you can see that it's been posted, you can actually tune in yourself.
And I think most organizations that do advocacy work, if you go to their website, you can sign up to receive action alerts, advocacy alerts. For example, you mentioned the Illinois Aging Equity Act proposed legislation, and the Illinois Aging Together Coalition is the lead organization that's sponsoring and advocating for that legislation to move forward. And you could, whatever organization you may feel connected to, or that's an advocate on the issues you care about, whether it's access living or whatever organization follows the issues that you care about, sign up for their advocacy alerts or their newsletters.
Fantastic. So could you all explain a little bit more what you mean by constituent legislation? If there's something that you want legislation about, how would you start that process on your own as a community member?
Well, Amy, I think you brought up the good example of House Bill 40, which was the bill that allows students who have individual education plans to stay in their school till after their 22nd birthday at the end of the school year. I know that piece of legislation came to be because a community member met with their state legislator, right? If I'm not mistaken, that's the background story of that. So it can be as simple as scheduling a meeting in your legislator's office, and that can really spark something going forward. Not all the time, but certainly that can be the beginning of the spark there. Because it's very compelling for legislators, I think, to hear from constituents in their communities versus from elsewhere in the state.
And I would just add, you certainly, it doesn't hurt if you think there might be a coalition and that maybe you've never been engaged with before. And they're usually run through not-for-profits. There's usually someone that you can speak with there. You can ask them about it. Is this something that you've thought about? Would you be willing to work on it? Would you come with me to my meeting with my legislator? They love it when there are advocates that will help shepherd that legislation along.
Fantastic. Sharon, you were muted. It looks like.
I was just saying we have a few minutes left. Is there one more question we didn't get to?
I have a question. I know that there are so many ups and downs, so many challenges, wins, losses in this policy advocacy world. So how do you all stay hopeful? How do you strategize differently in those more down times or after maybe something doesn't pass that you were working on?
For me, we used to say, oh, well, it'll be quieter in the summer. It never is quiet anymore. But I personally, I thrive on the relationship building, and the idea that I am serving my community and making Chicago a little bit of a better place for my community and for people like me. I think that absolutely creates a sense of optimism and hope. Because we do steward so many relationships with elected and appointed officials and coalition folks, occasionally we get, a little whisper, oh, this is coming down the pike, be ready, right? So I think that helps us stay, prepared for whatever may come next, and help marshal our resources before the crisis happens.
That was a wonderful answer, and it's a wonderful note on which to end. We want to thank you so much for those of you who attended today. We want to thank Jane and Amy and Jared. We want to thank Faith, our ASL interpreter, and we want to thank our live CART transcriber. Thank you so much for being here with today. And as you leave the webinar today, our evaluation for today's program will pop up. Please take the time to complete it. And we really value your ideas for improving our programs or future program ideas. Again, copy of the slides today will be sent via email, and a link to our website where a recording of this program and other insights on aging programs can be found will also be emailed to you. Thank you again so much. Have a good rest of the day.